Have you noticed that lately, just sitting for a little while makes your lower belly feel heavy, achy, and uncomfortable? Then at night, just as you're starting to fall asleep, you have to get up to use the bathroom. Not once, but sometimes 3 or 4 times a night. Your body starts feeling worn out, your sleep breaks into pieces, and you wake up feeling groggy, like you didn't rest at all. If you're a man over 60 and quietly dealing with this every day, your prostate might be trying to tell you something. But here's the good news. You don't have to just live with it. Today I want to share something simple and gentle, yet it could change your quality of life. It's not a pill, not a surgery, and it doesn't cost much. It's just a cup of tea. Yes, a herbal tea, but not the kind you're used to. This is one of 7 types of tea that have helped thousands of men over 60 escape sleepless nights, discomfort from sitting too long, and that constant pressure in the lower belly. I'll walk you through each of these 7 teas one by one, and if you stay with me to the end of the video, you'll discover the strongest one. It's the least known, but it's trusted by many natural health doctors. And who knows, it might be exactly what you've been looking for. If you see yourself in what I've just described, do me a small favor. Please like this video and subscribe to the channel so I can keep bringing more helpful tips to men like you. And if you truly want relief from prostate pain, leave a comment below saying, "I want to find a tea that helps with prostate pain." That simple step could be the start of a more comfortable journey, one you fully deserve. 1. Green tea. Did you know that in a simple cup of green tea lies a gentle yet profound ability to relieve pressure in the lower belly, especially for men over 60? Imagine every morning as you sip a drink that not only warms your body, but also quietly nurtures the health of your prostate in the gentlest way. Science has shown that green tea is rich in catechins, especially EGCG, epigallocatechin gallate, which has powerful anti-inflammatory effects in the body. Many studies indicate that EGCG helps suppress inflammation factors in prostate tissue, reducing swelling and improving symptoms related to urination. A meta-analysis of thousands of people in Japan also found that those who drank more than 7 cups of green tea daily had a 44% lower risk of developing prostate disease compared to those who drank less. At the Moffitt Cancer Research Center in Florida, a 6-week clinical trial showed that people who consume green tea extract equivalent to 500 to 1,000 milligrams of EGCG daily experienced significant improvements in urinary flow, noticeable reduction in inflammation, and overall better comfort in their daily activities. What's special is that all these benefits come gradually, without the disruption or side effects typically associated with medications. I once spoke with a man in his 70s, and he shared that after switching to green tea in the morning instead of coffee, he found he slept better because he had to get up to use the bathroom less. His lower belly felt much lighter. It wasn't magic, but the result of a consistent and wise choice. To preserve the full benefits of green tea, it's best to brew it at a temperature of 80 to 85 degrees Celsius, 176 to 185 degrees Fahrenheit, as boiling water can destroy its beneficial compounds. Use 1 teaspoon of loose tea or a tea bag and steep it for 3 to 5 minutes. It's best to drink it in the morning and early afternoon, avoiding consumption after 5 p.m. to prevent it from affecting your sleep, as green tea still contains a small amount of caffeine. Additionally, a recent study published in 2025 shows that regular green tea consumption can reduce PSA levels, a crucial marker for prostate inflammation or enlargement, and helps maintain stable weight and metabolism in older adults. This further demonstrates that green tea not only helps with symptoms, but also plays a long-term protective role for prostate health. However, moderation is key. Drinking too much, more than 6 to 8 cups a day, can put pressure on the liver or lead to excessive caffeine levels, especially for sensitive individuals. If you're taking medication for liver or blood pressure issues, it's best to consult your doctor before adding green tea to your daily routine. In summary, green tea is a quiet yet effective companion for prostate health. If you persist in using it the right way each day, you might just notice the change: deeper sleep, smoother urination, and a gradual disappearance of the pressure in your lower belly. If you've ever been frustrated by waking up multiple times during the night just to use the bathroom, leave a comment saying, I believe green tea helps reduce prostate pain. This moment could be the start of a more natural and soothing recovery for your body. 2. Pumpkin seed tea. You might be surprised, but something as simple as pumpkin seeds, something you might find in your cereal bowl or snack on roasted, holds a valuable secret for prostate health. Imagine every day with just one gentle cup of pumpkin seed tea, you're quietly empowering your body to fight against sleepless nights and that unnamed pressure in your lower belly. Medical studies show that pumpkin seed extract, cucurbita pepo, is remarkably effective in reducing symptoms of benign prostatic hyperplasia, BPH. A 12-month trial, Granu study, involving 1,431 men aged 50 to 80, showed that those who took 5 grams of pumpkin seeds daily had significant improvements in the IPSS score, International Prostate Symptom Score, compared to the placebo group. Not only that, previous research indicated that pumpkin seeds and their oil can reduce prostate volume in animal experiments, inhibiting the 5-alpha reductase enzyme, which converts testosterone into DHT, a major culprit in prostate enlargement. But there's more. Pumpkin seeds are rich in zinc, phytosterols, and carotenoids, 3 nutrients proven to support prostate function, reduce inflammation, and stabilize weight in older adults. A review on Healthline also highlights that pumpkin seed oil helps reduce the frequency and severity of BPH symptoms without causing concerning side effects. I remember once meeting a man over 65, and he shared that he used to wake up 3 to 4 times a night to use the bathroom. After a few months of drinking pumpkin seed tea in the afternoon, he said his nighttime trips to the bathroom dropped to only 1 to 2 times. He mentioned that he felt his belly lighter and his spirit brighter. It wasn't magic, but the result of a small but consistent habit. Making pumpkin seed tea is simple. Lightly roast 1 to 2 teaspoons of shelled pumpkin seeds over low heat until fragrant. Then boil about 200 milliliters of water, add the seeds and let it simmer for 10 to 15 minutes. Strain the seeds and drink 1 to 2 times a day, preferably in the afternoon or early evening, to avoid affecting sleep. Note: pumpkin seeds are rich in fiber and oil, so drink in moderation, 5 to 10 grams per day. If you have a history of digestive issues or a sensitive stomach, it's best to start with a lower dose to allow your body to adjust. In summary, pumpkin seed tea is not only a warm beverage, but also a natural remedy that supports prostate health, reduces nighttime urination, and restores comfort in your daily activities. If you've ever experienced those exhausting nights of running to the bathroom multiple times, try leaving a comment saying, "I hope my nighttime urination decreases thanks to pumpkin seeds." And let's share this gentle yet effective journey together. 3. Nettle leaf tea. After discovering the benefits of green tea and pumpkin seed tea, let's explore another wonderful herbal companion, nettle leaf, also known as Urtica dioica. This herb has been traditionally used for centuries, especially in Europe, to reduce symptoms of benign prostatic hyperplasia, BPH. But what's even more impressive is that modern science has now proven its effectiveness, and the results are quite convincing. According to multiple studies, nettle leaves contain active compounds such as phytosterols, lignans, flavonoids, and caffeic acid, all of which have anti-inflammatory, antioxidant properties and inhibit the 5-alpha reductase enzyme, the enzyme responsible for converting testosterone into DHT, the substance that promotes prostate enlargement. A 2007 trial on men with BPH showed that the group using nettle root extract had significant improvements in nighttime urination frequency, urinary flow strength, and the feeling of bladder fullness after urination compared to the placebo group. Notably, a 2018 meta-analysis ranked nettle root among the 5 most effective herbal treatments for BPH. The well-known health website MedicineNet also noted that extracts from nettle root and leaves show effects similar to some BPH medications, like finasteride, but with fewer side effects, something particularly important for older adults. Another 8-week trial with over 100 participants who took 450 to 1,200 milligrams of nettle leaf extract daily showed a 20% decrease in PSA levels, significant reductions in nighttime urination frequency, and a more than 30% improvement in the IPSS score, International Prostate Symptom Score. I still remember the story of a man in his 70s. He used to wake up 3 to 4 times a night to use the bathroom and always felt a tightness in his lower belly, especially when sitting for long periods or bending down. After about 2 months of drinking nettle leaf tea in the afternoon instead of black tea, he shared that he now only wakes up once a night and feels his bladder much lighter, a change he never thought could happen. This is proof that sometimes a small habit done right can bring about big changes in life as we age. Nettle leaves not only help improve symptoms, but also support bladder function, reduce systemic inflammation, and increase overall antioxidant capacity. A 2020 study even showed that combining nettle leaves with other herbs, like saw palmetto, could increase effectiveness by 60% compared to using them alone. Making nettle leaf tea is simple. Use 2 to 3 teaspoons of dried nettle leaves, steep in about 250 to 300 milliliters of water at around 90 degrees Celsius, 19.4 degrees Fahrenheit, and let it sit for 10 to 15 minutes. Drink once a day, preferably in the afternoon, to take advantage of its natural diuretic properties, helping your body gradually balance and detoxify the urinary system. Some people even add a bit of lemon or honey to make it taste better. An important note is that nettle can have a mild effect on blood sugar and blood pressure due to its diuretic properties. If you're taking medication for diabetes, high blood pressure, or diuretics, it's advisable to consult your doctor before using it regularly to avoid any unwanted interactions. In summary, nettle leaf tea is a reliable herbal choice that helps reduce nighttime urination, improve sleep, and bring more comfort after urination, especially for those suffering from prostate enlargement. If you've had uncomfortable nights and restless sleep just from waking up repeatedly, consider trying this herbal remedy. If you're ready to give it a try, leave a brief comment below. I choose nettle tea to care for my prostate, and let's share real-life experiences from the community about its actual effects. Let's build a healthier and easier journey together every day. 4. Turmeric ginger tea. You might think of turmeric and ginger as just common kitchen spices, but in both traditional and modern medicine, they are silent warriors. Turmeric, which contains curcumin, and ginger both contain active compounds with anti-inflammatory properties. And that's why you can feel the soothing effect on your lower abdomen and bladder after using them. Clinical studies show that curcumin, the golden compound in turmeric, has the ability to significantly reduce inflammatory markers like IL-6 and TNF-alpha in prostate tissue, helping to reduce swelling and improve urinary flow. A 6-month study combining curcumin with tamsulosin and finasteride showed impressive results. Significant improvement in symptoms like difficulty urinating, incomplete urination, and even sexual health in men with benign prostatic hyperplasia, BPH. Ginger is just as powerful. In laboratory studies, ginger extract has been shown to inhibit prostate cancer cells, initiate apoptosis, cell death, and reduce the growth of abnormal cells. Ginger is also very effective in reducing inflammation, improving blood circulation, and alleviating the nagging pain that many older adults experience. I remember a man in his 70s I often meet who shared, "I feel less pressure in my lower belly, and my urination is smoother after drinking turmeric and ginger tea every night." That's not just a marketing slogan, but the real result of a simple habit that brought actual change. How to brew the perfect turmeric ginger tea: boil 1 cup of water, about 200 milliliters. Add half a teaspoon of turmeric powder or a few slices of fresh turmeric, along with 3 to 4 slices of fresh ginger. Let it simmer gently for 10 minutes. Add a pinch of black pepper to enhance curcumin absorption, and honey if you prefer it sweeter. Drink once a day, preferably after dinner. A gentle reminder: turmeric and ginger are generally safe, but for those taking blood thinners, steroid pain medications, or diabetes medications, it's essential to consult a doctor to avoid any interactions. When used properly, turmeric and ginger tea not only helps relieve prostate discomfort, but also promises a good night's sleep and a lighter, more relaxed body each day. If you've tried this method and noticed the benefits, leave a comment saying, "I feel more relaxed with turmeric ginger tea," to share your experience and inspire others on this natural health journey. 5th, saw palmetto tea. After experiencing the benefits of turmeric ginger tea, let's continue our journey with the 5th tea, saw palmetto tea, known as a natural treasure for supporting the relief of prostate-related symptoms. You may have heard of saw palmetto from people who have used it as a substitute for prescription medication. But what does science say about this herb? The American Academy of Family Physicians, ARAFP, has considered it a reliable candidate for supporting the reduction of BPH symptoms, with effects comparable to some common medications, but at a lower cost and fewer side effects. They synthesized data from 21 randomized trials, including studies on urinary flow and sleep, showing that saw palmetto users experienced a 25% reduction in the frequency of nighttime urination and enjoyed deeper, more stable sleep compared to the placebo group. However, not everyone praises it. The National Center for Complementary and Integrative Health, NCCIH, in the U.S., has warned that several large trials, including over 5,600 participants, found saw palmetto to be no more effective than a placebo in terms of urinary flow or prostate size. Similarly, the most recent review in 2023 concluded that the results for BPH symptom relief were limited. However, a new study shows that saw palmetto oil extract, which contains an additional 3% beta-sitosterol, has shown more noticeable effects. In a 12-week trial with a daily dose of 500 milligrams, the saw palmetto group with added beta-sitosterol had significant improvements in IPSS, International Prostate Symptom Score, reduced post-void residual urine volume, and increased maximum urinary flow compared to the placebo group. In summary, the addition of beta-sitosterol could be the key factor in determining saw palmetto's actual effectiveness. In other words, saw palmetto isn't a miracle, but if you use the right form, especially the oil rich in beta-sitosterol, there is real potential to improve symptoms of nighttime urination, weak urine flow, and sleep. I remember meeting a man over 60 who shared, "After switching to saw palmetto tea dissolved in warm water, I now only wake up once a night, or sometimes not at all." This isn't just a marketing claim, but the concrete result of wisely changing a habit. How to brew saw palmetto tea? Use 1 to 2 grams of dried berries, about 1 teaspoon, and steep them in 300 milliliters of boiling water. Cover and let it steep for 15 minutes. Drink in the evening, ideally 30 minutes before bed, to help support deeper sleep. Avoid using it too late to avoid disrupting your sleep. Note: saw palmetto rarely causes side effects. Some people may experience mild bloating or increased urination frequency when starting. If you're on blood thinners, hormone treatments, or monitoring PSA levels, it's best to consult with your doctor to ensure safety. In summary, saw palmetto tea, especially in the form of oil rich in beta-sitosterol, could be a worthwhile option to relieve BPH symptoms, improving sleep quality, reducing nighttime urination, and stabilizing urinary flow. If you've ever been up in the middle of the night to urinate, leave a comment saying, "I hope saw palmetto helps reduce my nighttime urination," to share your hopes and connect with others on this health journey. 6. Pygeum bark tea. Continuing our journey of exploring teas that support prostate health, we now come to a natural treasure, long trusted in traditional African medicine. The bark of the Pygeum tree, a symbol of strength and resilience in every small cup of tea. Pygeum africanum, a tree native to Central Africa, has been used in indigenous medicine for centuries to treat urinary tract issues. Today, modern research has proven that extracts from Pygeum bark contain phytosterols, ferulic acid, and triterpenes, which help reduce inflammation, stabilize urinary flow, and alleviate the feeling of incomplete urination. A meta-analysis of 17 randomized controlled trials involving over 900 people showed that those who used Pygeum extract daily, equivalent to 50 to 100 milligrams, had a 30% greater improvement in their IPSS score compared to the placebo group. In addition, they experienced a reduction of 2 to 3 nighttime urinations on average and a significant improvement in urinary flow. These results are further supported by prostate treatment guidelines, such as the Phytotherapy Guideline from the German Society of Phytotherapy, which highlights Pygeum as an effective natural therapy. Not stopping there, according to reports from Mayo Clinic, Pygeum extract also helps reduce inflammation, supports bladder function, and improves overall quality of life, especially important for older adults. I remember an elderly man in his 70s who, after switching from prescription medication to drinking Pygeum bark tea every night, shared, "It's been a long time since I felt the sensation of incomplete urination. Now I only wake up once at night, or sometimes not at all." This is proof that a simple yet meaningful decision can make a difference. How to brew Pygeum tea correctly is easy. Use 1 teaspoon of powdered Pygeum bark extract or ground dried bark and add it to 300 milliliters of hot water, about 90 degrees Celsius or 194 degrees Fahrenheit. Cover and steep for 10 to 12 minutes. Drink once a day in the evening to help you sleep better and reduce nighttime urination frequency. A small note, Pygeum rarely causes side effects, but if you have low blood pressure or are taking diuretics, it's advisable to consult with a doctor before using it long-term. Now you have another option, Pygeum bark tea, to support prostate health. If you're looking for a natural way to stop waking up in the middle of the night to urinate, leave a comment saying, "I choose Pygeum for deeper sleep," to spread hope and share this gentle journey together. 7. Ryegrass pollen tea. Now that we've explored each cup of tea like familiar friends, from green tea, pumpkin seed tea, nettle leaf, turmeric ginger, to saw palmetto and pygeum, let's finally turn to a lesser-known tea with surprisingly powerful effects. Ryegrass pollen tea. It's no coincidence that ryegrass pollen has become a well-kept secret in various European and Asian medical traditions. Systematic studies, including 4 double-blind trials with over 400 men suffering from benign prostatic hyperplasia, BPH, show that using charlatan, an extract of ryegrass pollen, significantly improves symptoms of nighttime urination and the feeling of incomplete bladder emptying compared to a placebo. Furthermore, more recent reviews from Phytotherapy, 2019, affirm that pollen from various grasses, including ryegrass, helps alleviate BPH symptoms and chronic prostate inflammation. The mechanism is quite fascinating. The amino acids, phytosterols, and enzymes in the pollen help relax smooth muscles in the bladder and urethra, while also inhibiting inflammation and improving circulation. Key factors that cause you to wake up repeatedly just to urinate. According to experts at WebMD, surveys show that many users of ryegrass pollen feel more comfortable with mild to moderate urinary symptoms, although there is insufficient evidence to confirm it reduces prostate size. This means that this pollen helps manage symptoms effectively, more so than curing the root cause. I remember an impressive story. An elderly man in his 70s shared that, after a few weeks of drinking ryegrass pollen tea, he felt that, "Now I only wake up once at night, or sometimes not at all." Though this story was shared briefly, the emotional tone in his voice suggested it was truly a positive change. How to brew ryegrass pollen tea? Use 1 teaspoon of charlatan powder or dry pollen and steep it in 200 to 250 milliliters of boiling water for about 10 minutes, then drink it in the evening, 30 minutes before bed. Patience is key. Use it continuously for 8 to 12 weeks, and you'll notice more stability in your urinary flow and less fatigue from sleepless nights. An important note is that studies are still limited on the long-term effects or ability to prevent BPH complications. WebMD and medical sources like Hartford Hospital recommend that you have regular health checkups to rule out the risk of prostate cancer. Consult with your doctor if you are taking other medications, as pollen may mildly interact with some diabetes or blood pressure treatments. In summary, ryegrass pollen tea is a promising natural option to manage BPH symptoms, reducing nighttime urination, relieving pressure in the lower abdomen, and promoting deeper sleep. If you're looking to say goodbye to sleepless nights due to urination, leave a comment saying, "I choose ryegrass pollen tea for better sleep." A gentle yet meaningful commitment to both your body and mind. And so together we've journeyed through the exploration of 7 natural teas that can bring about significant changes for your prostate, from the familiar green tea to the lesser-known ryegrass pollen. Each cup of tea, when used properly and consistently, not only helps reduce nighttime urination, relieve pressure in the lower abdomen, and improve urinary flow, but also gives you those small yet incredibly precious things: a restful night's sleep, a light morning, and a calm mind to start the new day. In reality, prostate health isn't about a one-day fix or a single pill. It's a long journey that requires patience, listening to your body, and making wise choices each day. If, after watching this video, you decide to take a little time each afternoon to brew a cup of tea for yourself, I believe you've just taken a firm step toward a healthier, more peaceful life. If you found the insights in this video helpful, don't forget to leave a comment affirming with gentle yet strong determination. I'm starting my prostate health journey today, and if you have any questions or want to share personal experiences, feel free to leave a comment below. I and the community would be happy to listen to you. Please note, all the information in this video is for reference only. We do not replace professional medical diagnoses or treatments. Always consult with your doctor before making any changes related to your health. And if you're looking for the next step in your senior health journey, check out the video currently on your screen or choose one of our suggested videos on the right or below. Every video is a helpful piece that helps you understand your body better and live healthier every day. Remember, taking care of your prostate isn't hard, as long as you start with the smallest things, like 1 cup of tea every day. Thank you for watching. I'll see you in the next video.